and welcome to another episode of What's on Tap. I have Heidi Cehan, our nurse practitioner for SLMA, with us, and she is looking all beautiful and glowing because she is expecting. So how far along are you, Heidi?
So I'm actually 30 weeks this week, due sometime in June, so right around the corner.
Awesome. And tell me a little bit about what you're going through with your skin since you've been pregnant. This is your first pregnancy, correct?
Yes.
Okay.
Mm-hmm.
So are things normal or are things a little different?
Things are different, I find, for sure. I find that I am breaking out more. I definitely broke out more in the first trimester, and then now it's coming back in the third trimester.
Yeah, those hormones are fun,
Mm-hmm.
and unfortunately we experience them as women
Yep.
throughout our whole lives,
Yep.
but especially for pregnancy.
Mm-hmm.
So I did come up with a few skincare tips for you. Now you are how old?
I am 24.
Okay, so you're a pregnant 24-year-old, which you probably don't have a lot of anti-aging issues, but pregnancy is a time where your hormones are doing things that can cause those issues later on, so I'll talk to you about that.
Okay.
But as far as the breakouts, what are your feelings about salicylic acid? What does your OB say? Because I know some do not want you to have salicylic acid on your skin. Some do not care.
Right.
Where are you?
It kind of just depends on what your OB/GYN says.
Yeah.
I specifically haven't talked to mine as much about it because I've been using the products from over here, the hydrating skin wash, and I've been keeping my skin as clean as possible, trying to avoid excess makeup on my face during this time, just because I noticed that as I wear more makeup, I find that the breakouts are actually a lot worse.
Okay.
So I've been trying to keep my skin as clear as possible. I do wear sunscreen whenever I do go outside because my husband and I often go fishing or spend time outside.
Yes.
So I've actually been using some of our products here that it's actually the tinted sunscreen.
Yes.
I've been using that.
Okay.
And I don't find that causes excess breakouts at all.
Awesome.
Yeah.
So, I always tell my clients whatever your OB wants you to use, whether or not they want you to use the salicylic, it's really up to them.
Right.
And that goes for when you're breastfeeding as well.
Correct.
Traditionally, with breakouts, we would use salicylic acid, benzoyl peroxide, retin A, but when you're pregnant, you may not be able to. So I pulled out this probiotic mask, which when I gave you your facial, you got to experience, and it is a yogurt-based mask, and it helps your skin's natural flora to come through, and we know that probiotics are great for breakouts, and it also has a lot of really good antioxidants, and that will be really important for you when you're pregnant, to help prevent things like melasma and sun damage. So this is a great mask. You can leave it on for about 10 to 15 minutes, and I think that would be safe for you and also help you with your breakouts.
Yes.
Okay, so as far as sunscreen, you are using a sunscreen. I'm very happy about that because I don't know if you know, but there's something called a pregnancy mask.
Yes.
That can happen when you're pregnant. And you're 25, so you're probably not worried about those things, but let me just tell you, when you're 30 is normally when they come out, or right after pregnancy.
Right.
And then we have to do a lot of treatments to help correct that. But skincare-wise, while you're pregnant, the biggest lightening agent out there is hydroquinone, but that's also another controversial thing when you're pregnant. So I pulled out, this is my personal favorite skin lightening product.
Okay.
I am not pregnant, but I just didn't want to use the hydroquinone anymore. If my melasma was severe, then I'd probably use it for a couple of months, but hydroquinone is not something that you want to use all the time anyway. But this is a lightening product. It is equivalent to a 4% hydroquinone. It's called Even Tone by Skin Better. And it is not a hydroquinone product. They have their own patented formula. They call it BORYT, and it's more natural skin lighteners. And what I find with this one is it lightens the browns
Okay.
the yellows, and the reds. So this could be something that you can use while you're pregnant, because even though you're not visibly seeing the pigment, it could be happening underneath the skin.
Right.
So you can start correcting this right away.
Okay.
Throughout your pregnancy, and then just stay on it.
Okay.
And then obviously sunscreen is extremely important. As far as your makeup, just be careful what kind of makeup you're using, because there are some makeups that have preservatives in it that could be clogging the pores. So this is a sunscreen and a powder, and it's mineral. So mineral makeup does not absorb into our pores. It sits on top of the skin, so it's very healthy for the skin.
Okay.
And it's a 50, so you can use this while fishing, running. Once your baby's born, you want to take your baby out for a jog, you can even put this on your baby.
Okay,
Ariana, my daughter, she only uses this.
Oh, awesome.
So she even wanted me to take this to summer camp because she does not want to do the lotion on her face. So it's very safe.
Okay.
Same rule applies with any sunscreen. Reapply every 2 hours. But you could also use this as your makeup.
Okay, perfect.
And then I also have the liquid physical sunscreen by Skin Bar. I know you said you're already using it. It does have a little bit of a tint, so it can be kind of like makeup.
Right.
And you can even combine these two if you like to do a liquid and you like to do a powder, or you can put this on first, and then as you're reapplying through the day, if you do have makeup on, it's kind of hard to reapply with your liquid. So this is a good one that you can just powder on. So so those are some tips. I did forget about Skin Bar. We have a phytoquinone fader.
Okay.
And so this is another non-hydroquinone skin lightening product. It's a little less expensive than the Skin Better. I still prefer the Skin Better, but it does have some botanicals in it. It's also hydrating, because I'm sure you find when you're pregnant, sometimes you might dry out a little more, and it might be a little more oily, so you have to find that balance with your skin. But this is another option that we have that's safe for the pregnant women to use.
Perfect.
Okay, well, thank you so much, Heidi, for coming to our show, and we can't wait to see that cute little baby of yours. And you do not know the sex.
No, we don't know. No.
Okay, how exciting. All right, well, we can't wait for our new little member in Skin Bar, and you look beautiful. Thank you for coming.
Thank you for having me.
All right, and if you have any other suggestions of what you would like us to talk about on the show, let us know, and don't forget to like, share, and subscribe. Thanks. Please like us on Facebook and subscribe.